What are invasive versus non-invasive cancer diagnostic tests? Imagine trying to find out if someone has a hidden problem inside their body. You might need different tools to see what's going on. That's what doctors do when they look for cancer. They use two main types of tests, invasive and non-invasive. Knowing the difference can help families understand what to expect during diagnosis and staging. Invasive tests are like opening a door to look inside. They involve physically entering the body. For example, a biopsy is a common invasive test. It means removing a small piece of tissue from a suspicious lump or tumor. This tiny sample is then looked at under a microscope to see if cancer cells are present. Biopsies can be done with a needle, a small cut, or during surgery. They give very detailed information about the type of cancer, how aggressive it is, and how far it has spread. But because they involve breaking the skin or entering the body, they can cause discomfort, bleeding, or infection. Sometimes, anesthesia is used to make the process less painful. Families should know that while invasive tests are more uncomfortable, they give the clearest picture of what's happening inside. Non-invasive tests do not require cutting or entering the body. Instead, they use imaging or analyze body fluids like blood or urine. For example, imaging tests include ultrasound, magnetic resonance imaging, computed tomography scans, and optical imaging. These scans create pictures of the inside of the body, showing where tumors might be growing. Blood tests called liquid biopsies look for tiny pieces of cancer DNA or proteins released by cancer cells. These tests can sometimes spot cancer early or monitor how well treatment is working. They are safer and cause little to no discomfort. However, non-invasive tests might not always give a complete answer. They often need to be followed by invasive tests to confirm the diagnosis. From a caregiver's point of view, non-invasive tests are easier to repeat and less stressful for loved ones. They are useful for initial screening and ongoing monitoring. Invasive tests, while more uncomfortable, are essential for confirming cancer and understanding its exact characteristics. They help doctors decide the best treatment plan. To sum up, invasive tests involve entering the body, like biopsies, and give detailed, definitive results. Non-invasive tests use imaging or fluids, are safer and easier to do, but sometimes need confirmation. Knowing these differences can help families prepare emotionally and practically for what their loved one will go through during the diagnosis process. Multiple tests might be needed to get the full picture of the cancer's presence and stage.